Hi, this is our debate on the right to exercise personal liberties versus the need for habilitation. I'm Andy. We have Janine, Cameron, Sarah, and Kayla. Okay. Hello, and welcome to today's debate on a core ethical challenge in applied behavioral analysis, balancing client autonomy with treatment effectiveness. As Bear-Wolf in Risley 1968 outlined, ABA is grounded in 7 dimensions: applied, behavioral, analytic, technological, conceptually systematic, generality, and effective, all aimed at improving quality of life through data-driven, individualized, and ethical intervention. But as we work with clients, especially those with limited communication or in intensive programs, we face a growing challenge. Does promoting client assent and autonomy help or hinder effective outcomes? Choice and autonomy are vital life skills, but can sometimes conflict with the structured, outcome-focused nature of ABA. Overly rigid programs risk ethical and emotional harm. Today's debate will explore both sides. The pro side advocating for autonomy-based practices to enhance quality of life, and the con side highlighting a possible stress and ethical issues from pushing participation too far. We'll also discuss BACB ethical standards, personal biases, and how these ideas relate to the 7 ABA dimensions in practice. We'll begin with the pro side, then the con side, followed by counter arguments, questions, and ethical analysis. Okay. Per Bannerman et al. 1990, personal liberties refer to freedom or the right to make choices without being influenced by coercion. In other words, people have the right to decide for themselves, and those decisions should be respected. It's our responsibility to respect and protect clients' legal and civil rights. This includes ensuring their privacy, dignity, and access to fair treatment. We also need to be mindful to avoid coercion or the unnecessary use of restrictive procedures. These should never be used for convenience or control and only applied when absolutely necessary for safety. Finally, we must always promote autonomy, which means giving the clients the opportunity to make their own choices whenever possible. This helps build confidence, independence, and a sense of personal control. Okay. Habilitation. Habilitation involves teaching the skills needed for individuals to live as independently as possible. This concept was defined by Favell et al. 1984. Unlike rehabilitation, which focuses on regaining lost skills, habilitation focuses on developing skills that may never have been acquired in the first place, especially for individuals with developmental disabilities. Bannerman and colleagues discussed in 1990 one of the most well-known cases in this area, which is Wyatt v. Stickney, which took place between 1971 and 1975. In this case, both an Alabama court and the Fifth Circuit federal court ruled that individuals with mental retardation had a right to individualized habilitation. The court stated that habilitation must offer each person a realistic opportunity to live a more meaningful and useful life, and ideally to return to society. As a result of the Wyatt decision, the court established minimum standards for habilitation. These included 3 key requirements. First, individuals must have personalized habilitation plans. Second, they must live in a humane physical environment. And third, facilities must have enough qualified staff to deliver appropriate treatment and support. Okay. Habilitation is deeply influenced by cultural factors, which affect both the effectiveness of interventions and the relationship with stakeholders. Key element that ultimately determines success, as highlighted by Fung and colleagues in 2016. Practitioners therefore need to gather information about relevant variables, such as the client's cultural, personal values, and preferred choices, and as emphasized by Dusson and Costello in 2022. For example, one client expressed a desire to modify their language only when facing more challenging tasks, but not simpler ones. This choice was shaped by cultural influences, demonstrating the importance of understanding these factors in habilitation planning. Okay.
So that brings us to the discussion of the importance of autonomy. Autonomy is a practical, life-changing skills for individuals with autism spectrum disorder. This diagram from Bro and Smith in 2023 shows a decision-making process, not for the learner, but for the behavior analysis. So when a learner asserts themselves by indicating when or where they want to work, or chooses not to engage entirely, the analyst faces a choice. They can either A, terminate the work session, allowing the learner to access a break, B, terminate the session and represent in a delayed session, offering reinforcement like edibles, tokens, or social praise. Or C, terminate the work session and analyze the contingencies for assent withdrawal and offer accommodations. So, this is where the debate between autonomy and compliance becomes real. If we prioritize autonomy, we honor the learner's withdrawal of assent and choice and make an accommodating option. So, this respects their agency and models assent based practices. It also reinforces a vital life skill, which is self advocacy. But if we lean towards compliance, we risk overriding the withdrawal and it may undermine the learner's voice or lead to mistrust over time, which disrupts the therapeutic relationship. So, when we talk about autonomy versus compliance, we are not just debating methods, we are debating features. And choice based interventions like this one shows us that autonomy is not just ethical, it can be effective. Okay, so let's talk about why assent matters, not just as a procedural checkbox, but as a transformative practice in therapy and other educational environments. So, first, for our main arguments, assent helps build lifelong skills of choice. When individuals are given the opportunity to make their own decisions, even the small ones, it fosters autonomy and self determination. This isn't just in the moment, it's about cultivating a pivotal behavior that unlocks future learning and other personal growth. Second, honoring autonomy strengthens the therapeutic relationship. So, when we respect a person's right to choose, we build trust. And trust is ultimately the foundation of any effective intervention. So, over time, this leads to deeper engagement and better treatment outcomes in therapy. To go along with this, trust is important in the therapeutic relationship, not only with the client, but the stakeholders involved in that indirectly impact the autonomy of the client and their future success in treatment. Third, assent does not have to be disruptive or impractical. In fact, it can be seamlessly integrated into the therapeutic environment. With thoughtful design, practitioners can embed choice making opportunities into routines, making autonomy a natural part of the process rather than an exception.
That's a good point, Kayla. The Morris et al. 2024 article recognizes the ways that assent can be incorporated into treatment options, which include controlling choice and testing and confirming stimulus control. Incorporating assent can also be determined by the capacity of the client, which includes the age, level of maturity, mental state, and ability to give information. Assent should be assessed constantly to maximize opportunities that assent can be implemented, even if the client is unable to fully engage in the assent process. By maintaining awareness of when assent should be incorporated into treatment and utilizing the non-exhaustive options above, assent can be implemented seamlessly.
Exactly. Thank you for adding to that, Cameron. So, when we talk about assent, we must talk about how it is expressed and how it can be withdrawn. So, in this diagram, assent it shows that assent is not always verbal. Individuals may show assent by moving toward the practitioner, making eye contact if they can, orienting towards their body towards the practitioner, smiling, or even entering the treatment area. These are subtle but very meaningful indicators that they are willing to participate. Recognizing these behaviors honors their autonomy and ensures that they are not mistaking compliance for consent. But just as important as the ability to assent is the ability to withdraw assent. So, again, this can be nonverbal. It can include turning away, refusing to respond, touching a stop icon, or indicating in other communicative ways, or even engaging in escape behaviors that are always someone might communicate, no, I don't want to. If we ignore these signals, we risk violating their autonomy and potentially causing harm.
I think it is also important to recognize that the definition of dissent, as highlighted in Brown et al. 2017, which refers to dissent as a task refusal, and it is not the same as assent withdrawal. However, they both can occur prior to the request for engagement and also during session when engagement is prompted. I think it is also important to recognize that assent can be rescinded by the learner, not only regardless of their communication capabilities, but also regardless of age.
Yes, exactly. Thank you, Cameron. This framework, supported by Bro and Smith in 2023, reminds us that the ethical practice demands diligence, not just in what we do, but how we interpret and respond to the behaviors of those that we serve. So, in short, Ascent is not just a one time thing, it's dynamic and it's ongoing. If we are truly committed to ethical care, we must be fluent in both the language of assent and the language of withdrawal. Okay.
Okay, so now on the other side of all of that, I want to talk about why overly encouraging participation, especially in aversion-based, compliance-focused, or high-intensity programs, can actually be harmful. So while encouragement is often meant to help, research shows that too much pressure can backfire. When patients or clients are pushed repeatedly to comply with interventions they may not be comfortable with, stress and anxiety can increase. Jones, Smith, and Patel in 2023 found that excessive compliance-based participation can be psychologically taxing, particularly for vulnerable individuals. So high-intensity programs, or those demanding consistent compliance, can lead to burnout. Without breaks or opportunities for choice, clients can become mentally and emotionally exhausted, which reduces motivation and engagement. Over encouragement can also hurt self-esteem. So when a client feels forced to participate or is corrected constantly, their sense of competence and autonomy declines. This not only impacts learning outcomes, but can have long-term effects on confidence and well-being. So while encouragement is important, too much, especially in high pressure or compliance focused programs, can cause stress, anxiety, burnout, and then lower their self-esteem. So ethical programming must prioritize choice, voluntary participation, and safeguards that protect both learning and well-being. So encouragement might seem positive, but it often requires confronting our patient or our client's opinions and demands, which can generate ethical conflicts. One major ethical concern is maintaining our client's dignity and respecting their boundaries. Encouraging participation without careful attention can unintentionally pressure clients or violate their sense of autonomy. So Flowers and Dawes in 2023 emphasize that therapeutic assent is crucial. Clients must have the opportunity to express their comfort, preferences, and willingness to engage. Without this, even well-intentioned interventions can compromise respect and dignity. So another ethical area that we need to consider, it involves the physical prompting, especially with adults with disabilities. So while physical guidance can help teach skills, it must be applied carefully and respectfully, ensuring that the patient consents and retains as much autonomy as possible. LaRue, Manate, and Peppa et al. In 2025 highlight that economic and behavioral manipulations to influence choice must balance efficiency with respect for the client's agency. So overuse or coercion can lead to ethical violations. Encouraging participation sometimes means navigating these conflicting opinions or resistance from our clients. So ethical practice requires listening, adjusting, and promoting voluntary engagement rather than forcing compliance. Both Flowers and Dawes and LaRue et al. Support approaches that promote choice, assent, and client-centered decision-making to prevent these conflicts. So while encouraging participation is a key component of behavioral programs, it raises important ethical considerations, maintaining dignity, respecting boundaries, and carefully applying interventions like physical prompting. Promoting assent and voluntary participation ensures that we're following ethical integrity and we're supporting our clients' autonomy.
So I'm gonna talk about ethical consideration for It is challenging to balance and accommodate the values, beliefs, and opinions of individual actors involved in the ethical decisions. And this is especially important when we're working with individuals who have a trauma histories or communication challenges. For them, constant encouragement to participate, especially if it feels pushy or demanding, can actually cause distress, anxiety, or even a loss of trust. It's not always simple when we encourage more client input. We also open the door for ethical conflicts. What happens when the client's preferences clash with evidence-based practices or safety guidelines? For example, what if a client refuses certain procedures that we know is effective, but forcing participation would violate their autonomy? So right here, I strongly recommend that everyone ask themselves some questions. How can behavior analysis determine whether a client's assent is genuine versus compliance driven by pressure or evidence of punishment? Second question, when do participation goes across a line from empowerment to coercion? Third question, what are the ethical limits of physical prompting, especially with adults with developmental disabilities? The fourth question, how can practitioners balance evidence-based practice with respect for client autonomy and dignity? The fifth question, are there realizable methods or monitor stress and burnout in clients undergoing high-intensity ABA programs? Last question, should non-participation ever be considered a violent client choice? And how can that be ethically supported? Okay. One of the biggest ethical challenges we face as behavior analysis is figuring out how to balance clients' participation with their personal comfort and dignity. According to BACB Ethics Code 2.15, we are required to always use the least restrictive procedures and to seek a client's assent whenever possible. That means we shouldn't jump straight to physical prompt or coercive methods just to get a compliance. I hope this page will help us answer how do we encourage meaningful participation without coercion, and know how can we make sure our efforts to teaching independence don't accidentally compromise person's emotional well-being or sense of control. Okay.
That's a good point, Sarah. And also, to counter for the con, the structured choice reduces stress, building competence promotes autonomy, and choice is also feasible and ethical in implementation. So by giving clients the opportunity to choose, they are more likely to participate in tasks as outlined in Bannerman et al. 1990, and the McVeigh et al. 2023 article is a prime example of how choice not only encourages engagement, but also builds competence. It identifies a scenario of an individual who experiences autism. His parents wanted his goals to center around disruptive behavior, while he desires that his treatment goals center around his personal preference. However, an agreement was able to be made in which the client was able to exercise his choice, which builds decision-making skills into his repertoire to use in the future when engaging in self-determination scenarios. Choice can be feasible for practitioners as they can contrive opportunities into session to encourage choice. An example is including client preferences for addressing an individual as outlined in Bannerman 1990, and also following an 8-step decision-making model when including both the individual and stakeholders in McVeigh et al. 2023. Incorporating choice is feasible and a requirement by the BACB and relates to Code 211, as it could also reach and encompass assent to ensure choice is provided by the way of permission of the client and also ensures ethical practitioner performance.
Okay, we are going to get into our Q&A portion. What is assent and how is it different from consent in behavioral programming?
Thank you for your good question. So, assent is a formative agreement of an individual, often a child or adult with limited decision-making capacity or participation in an intervention. Unlike consent, which is a legal and formal authorization proved by a person with the full decision-making capacity or their legal guardian. Assent focus on individuals' willingness and understanding of the activities, even if they cannot legally prove consent. In behavioral programming, obtaining assent demonstrates respect for the client's autonomy and encourages a collaboration. Even when consent has been granted by parents, guardian, or legal representative.
Wow, okay. How do you determine if a client is giving genuine assent or showing discomfort or reluctance?
That's an excellent question. Thank you for asking. So, genuine assent can be indicated by clear, observable behaviors that show voluntary engagement, positive participation, such as, approaching the task willingly, orienting towards the practitioner, entering the treatment center or area, engaging with the treatment materials, just kind of showing the positive behaviors. Whereas like signs of discomfort can indicate assent withdrawal. So this can be avoidance behaviors such as like turning away, leaving the area, resistance, refusal to participate. It can even be like verbal communication using PECs, AAC, sign language, or it can be nonverbal. As indicated as the other behaviors. So in order to kind of ongoing take care of this issue, whereas if we have assent or assent withdrawal, practitioners should closely monitor for these cues in our children and individuals, and modify the intervention as needed to accommodate and prevent assent withdrawal.
Awesome. Okay. Very interesting. What procedures are in place to allow a client to withdraw assent safely at any time?
Yeah, so the procedures that one can implement to allow assent withdrawal are to immediately acknowledge their withdrawal and allow them the space, teach them to request a break by the PEC system, choice board, AAC device, or whatever form of communication that they use, and also allowing for choice. And the main important highlight is that the client knows that no matter how they communicate, that their break is not going to result in a penalty or reprimands from the practitioner.
Very interesting. Thank you. How do you encourage participation in challenging or high intensity programs without using coercion or aversive methods?
Thanks for asking that, Andy. So, participation can be encouraged by creating a supportive and motivating environment. And this is where we as practitioners would start implementing the antecedent strategies, right? So, that could be things like using positive reinforcement. So, rewarding effort and engagement rather than just like their correct responses to the task or the demand. Another one, like we've said several times, is choice making, allowing the client to select like the activities or the order of tasks that we're going to do that day, or the materials that we're using. So this is going to increase their sense of control, which then is going to increase their engagement. And then we move on to things like task shaping and scaffolding. So this is breaking down those harder tasks into smaller, more manageable steps. And then over time, gradually increasing the difficulty and the expectation. And then another would be natural reinforcement. So that is us as practitioners being able to connect the tasks that we're asking to meaningful outcomes or preferred activities like for the client. And then lastly, using modeling and peer support. So us demonstrating the task or the expectation and modeling what that looks like. And then if available and applicable, being able to use peers or siblings as positive role models to promote that engagement, right? So we're able to point out that a peer is sitting at their chair and starting their work, things like that.
Awesome. Thank you so much. Okay, in conclusion, today's debate highlights the challenge behavior analysts face in balancing client autonomy with effective treatment. Assent-based practices and choice interventions empower individuals with autism by building skills, trust, and improving quality of life. However, risks like ethical concerns, client stress, and safety, especially in aversion-based or intensive programs, must not be overlooked. Both sides share ethical obligations outlined by the BACB, including providing effective treatment, obtaining informed consent, and advocating for clients. Analysts must also recognize personal biases such as underestimating client competence or ignoring cultural needs to uphold professional standards. Ultimately, ABA aims to improve clients' quality of life through individualized programs that consider data, client and caregiver needs, culture, and ethics. With open dialogue and ethical care, we can develop treatment models that honor autonomy without sacrificing effectiveness. Okay. Here are our references.